you can be guaranteed a right. And yet if you don't have access, right, because there are a number of restrictions in your way that are meant to target you, because you don't have funds to access the care that you need, because there are no providers, because you live in an abortion desert, you still can't access the right in the same way. And it is not always a choice, right? Because in fact, we don't always have choices in the same way. Not everyone has equal choices. So the impact, right, of all of these abortion bans and healthcare bans are going to disproportionately impact Black, Brown, Indigenous people, people with low incomes, LGBT communities, the people who have the least access to resources, the people who've been invested in the least in our society, the people for whom we have the least empathy, right, are also the same people who are going to face the harshest barrier. The same states, as you said, that are banning access to abortion, like Georgia, are also not expanding Medicaid. They're also restricting voting, right? They're also many of the same states that have the highest maternal mortality rates. And we know that the Black maternal mortality rate is 3 to 4 times higher than white women. So either we're going to force people into pregnancy or perhaps force them into death, right? Like, that's the kind of craziness that we see with these kinds of restrictions, and how they make this not just a reproductive justice issue, but a racial justice issue.